Give the call to the member for Riverina.
Thank you, Deputy Speaker. Firstly, I want to commend the member for Mallee, the Shadow Assistant Minister for Regional Health, on bringing to the parliament this vital motion. And it is important, and if there's anybody in this place who would know just how integral it is to the success and the prosperity and the productivity of rural, regional and remote Australia, it is the member for Mallee, whose husband, my favourite Webster, Philip, husband of 47 years, is a long-serving GP at Mildura. And he understands fully well the pressures that the rural Victorian area faces, but rural Victoria is just like any other state. And I found it very interesting, intriguing in fact, to hear the East Coast Labor members coming in here and talking about distribution priority areas, like as if they would really know. Because when you really go out to regional Australia, to remote Australia, where you can kick the red dust around, there's just such a shortage of doctors. But for the Nationals, that shortage would continue. At least we have put forward, along with our regional Liberal cousins, policies that have helped ease the situation through the Rural Generalist Pathway. And I commend the member for Parkes, who just gave a wonderful valedictory speech, for the work that he did. The member for Lyne, who spoke earlier in this debate, and now the Shadow Minister at the bench, for the work that they have done, the work that they are doing, and the work that we will do in the future. And I look at the the Murray-Darling Medical School situation, particularly in Wagga Wagga, and we have a young student there, first-year student by the name of Madeline Ingram, educated at Mother Day Catholic College, just 23, in her first year at that wonderful facility. And it is a bright and shiny new facility, yet to be opened, 3-storey with a car park underneath. It's replacing the Harvey House, which is an old nurses' quarters which has been used since 1936. But the important thing, as the member for Lyne said, it's not about buildings, it's about people. And in the work that Dr Gerard Carroll and Dr Nick Stevenson and others have done to make this a reality, to get the professionals in, to give of their own time, just as Dr Philip Webster has done for many, many years, to give of their own time to make sure that we get the best outcomes in rural and regional health, and that's what it's all about. But Madeline Ingram, she spoke to me there recently at the topping out ceremony on April 15. That's where the 18-metre height was reached for this building, which will overlook Edward Street in the medical precinct there, just right next to Wagga Wagga Base Hospital. And she talked about the 90 students that will learn there, and she talked about the importance of actually starting the course, the course to which ends up getting your doctor's degree, and doing it from start to finish in a rural setting. Because all too often in the past we've seen the students, the brightest and best, start their course, go off to Sydney to do a couple of years and never come back. They fall in love with somebody, just like the member for Mallee did all those many, many years ago. Not too many member for Mallee, but you get my drift. But indeed, we want our student doctors to learn from the best, as in Drs Carroll and Stevenson and others. We want our doctors to be able to have beautiful new infrastructure, that they can feel the ambience, they can feel that there is a future in a rural setting, and we want them also to be let loose, so to speak, on our rural patients. Because it shouldn't be that when you're in pain you catch a plane. You have to catch a plane. It should be that our regional hubs, such as Wagga Wagga, Orange, Mildura, Shepparton, Dubbo, we have got those rural medical school through that Murray-Darling network. We have got the buildings, we have got the people, we have got the political will, thanks to the National Party. Thanks to the National Party, because it's been the National Party who pushed that, it's been the National Party that's delivered that, and I'm so very proud that it is making a difference, along with all the other options and policies that we've got forward and that we will bring forward to the next election. The member for Mallee is right when she says that the burden of disease experienced in the population increases with geographic remoteness. And it's not right, it's not fair, and let's not forget that it was these regional and remote Australians who carried this country during the COVID pandemic. They were the ones who still mined, they were the ones who still farmed, they were the ones who helped our balance of payments, and they're the ones we should never neglect never ever neglect and make sure they've got the best health outcomes for them in the future.